Atop a new development in the fight against coronavirus with important updates for you as your day ahead.
And we begin with some big changes at some local nursing homes. By tonight, the Huntersville Oaks nursing facility will transition to housing only COVID-19 positive patients. Residents who don't have the virus will move to other facilities all around the county. And many family members are worried about what that means for their loved ones' care. We'll have much more on that in just a moment.
Also starting today, banks will be limited to how much money they can lend under the Paycheck Protection Program. The Small Business Administration will only allow each of the big banks to loan 10% of the total stimulus. The SBA will also take applications in bulk in an effort to try to speed up the process of getting that money to companies that need it. And today, South Carolina Governor Henry McMaster is expected to issue a new state of emergency order. The Post and Courier reports that state law limits states of emergency to 15 days, but the governor can renew it with a new declaration. McMaster says he's still concerned about the widespread threat of coronavirus. And we told you last week, Governor McMaster created the group Accelerate SC. That's an advisory team that'll help determine when the state can fully reopen for business.
Eyewitness News reporter Anthony KUSTURA is live for us right at the state line. And Anthony, you have more on the recommendations and the current restrictions.
The expected state of emergency declaration today would be Governor McMaster's third since the pandemic began. Originally set to expire today, it actually would keep the stay or work from home order in place until the governor lifts it. Just last week, the governor already lifted restrictions on thousands of businesses across the state under a new order. That includes non-essential businesses like department, sporting goods, and craft stores. Those stores must limit customers inside to 20% of the building's maximum capacity and maintain social distancing. That executive order also allows beaches to reopen, but it's up to the local governments to decide whether to reopen public access. While receiving more than 1 million masks from China yesterday for South Carolina healthcare workers, the governor told reporters he expects to reopen the economy similarly to how it closed.
We're looking forward to getting back to work as quickly as we can, as safely as we can. In South Carolina, we want to recover that competitive advantage that we have had in prosperity for our people and make it grow and make it stronger.
The governor will meet with his Accelerate SC task force this week, the group in charge of successfully reopening the state. The plan is made up of 5 key components to get the economy up and running: response, protection, governance, resources, and information. One thing that still has not changed is people's ability to dine inside restaurants. Ahead at 5:30, I'll break down the steps one group is recommending to make that happen. Brittany?
All right, Anthony, looking forward to hearing that. Thank you so much. And after a weekend of reopenings in states like Georgia and Oklahoma, more states are now loosening their coronavirus restrictions. This week, Montana, Tennessee, and Minnesota and Iowa, they'll follow their lead. In states like Florida, well, they say that they're not there yet.
If people don't have confidence, then the economy's not going to just take off. That's just not the way it works.
Even hard-hit New York has a plan for reopening, if not a timeline. Governor Andrew Cuomo said yesterday an eventual reopening will be phased, starting with construction and manufacturing, but that all businesses should think about a new normal.
COVID-19 cases in North Carolina continue to climb. There are more than 8,800 cases in the state, 299 deaths. That's an increase of more than 200 cases and 10 deaths. Now in Mecklenburg County, there are 1,482 cases, 41 deaths. South Carolina now has more than 5,400 confirmed cases. 237 new cases were confirmed yesterday. There are now a total of 174 deaths statewide. In the last 5 minutes, we told you that Huntersville Oaks will begin transitioning to a facility exclusively for COVID-19 patients and will move its residents who are not sick to other locations in the county. Several families told us they were blindsided by that decision. Atrium Health says their plan is to house COVID-19 patients under one roof where they have some of the best equipment in the state. Still, families say they were not notified in time. They're also concerned with the physical and emotional toll this can have on their loved ones.
Alzheimer's patients have been proven with dementia that they cannot handle change very well. This could put my mother into a tailspin.
The moving process is expected to wrap up by tonight. We've been following the spike in cases at area nursing homes. A week ago, we told you those facilities had fewer than 1,100 cases and about 60 deaths. Since then, the number of cases has gone up more than 500, and the number of deaths more than doubled. Liberty Commons Nursing and Rehabilitation Center at Salisbury is the latest center with an outbreak. The county health department announced 2 of its staff members were diagnosed with coronavirus. They were sent home right away. All residents have been tested, and officials are waiting for the results to come back. Health workers in Salisbury also dealing with outbreaks at several facilities. At least 4 people have died at the Salisbury VA home. They also have 9 positive cases. The Citadel Salisbury has already had more than 100 COVID-19 cases. One family is suing the facility now, saying it didn't do enough to prepare for the virus. But a new North Carolina bill could prevent frustrated families from suing nursing homes. It aims to protect healthcare facilities and providers like nursing homes from liability that could come from their treatment of patients during the pandemic. It could go to the House floor as soon as this week.
And many of you may have heard that there is a proposal for another stimulus package out there to help struggling families, but right now it is only a proposal. Last week, 2 Democratic congressmen introduced the Emergency Money for People Act. It would give Americans a monthly check until employment gets back to normal. It is $2,000 a month, $4,000 for married couples, and $500 for each child. So for a family of 4, they would get $5,000 a month. Now, there would be some limits to this. If a single person makes more than $130,000 a year, or a married couple makes $260,000, then they wouldn't get the money. Now, the proposal is getting a lot of support online, but it is facing some opposition. Congress and the president have all said that we may need another stimulus, and soon. But they have different ideas for what that would look like. Some suggestions include helping with money to pay your mortgage or your rent, help for companies to keep paying you and possibly hire more people, and even spending money on infrastructure projects to get Americans back to work. And the IRS is asking for thousands of its employees to voluntarily go back to work. The agency says that it needs more workers to perform what it calls essential functions like opening mail and processing paper returns. It is all to help get taxpayers their refunds. The IRS says that it will follow social distancing guidelines and require masks. The agency is also offering incentive pay for those returning workers.
British Prime Minister Boris Johnson is back at work today, 3 weeks after the coronavirus landed him in the ICU. The Prime Minister has fully recovered from the virus. Johnson's return comes in the middle of major criticism against the government for how it handled the outbreak. The number of British COVID-19 deaths reached 20,000 over the weekend.
And with so many people working from home, the demand for gas is now plummeting, and well, so are the prices. It has dropped now 9 cents just this week, and hey, get this, in just the last 9 weeks, it has dropped 61 cents. Right now in North Carolina, the average price is $1.65 per gallon, and in South Carolina, it's 8 cents cheaper. Both are well under the national average of $1.77. And of course, we're here to help you. You can always find the cheapest prices in your neighborhood by using the WSOC app. All you have to do is look under the traffic tab.